Hi, my name is Dr. Trad. I'm an invasive cardiologist at Stillwater Medical Center, graduate of Oklahoma State University, and I am 41 years old with a recent, very important story to tell. So 10 days ago, I was in the middle of a procedure at around 8:30 in the morning, and I started having chest discomfort in the middle of the procedure. At first, I thought it was just, anxiety, and I was planning on going to Uganda on a medical mission on Monday. So there are a lot of things going on behind the scenes, and I could have easily contributed it to that. At the end of the procedure, I started having pain radiating to my neck and a little bit to my left arm, and that's when I knew I had to look further into it because I do have family history of premature coronary disease. And in my case, I had an uncle and a grandfather that both died of NMI at the age of 40 to 45. So I'm right there in my early 40s. I exercise regularly, I eat very healthy, and I actually practice what I preach. So there was no way that I could have done differently that would have prevented that from occurring. So got it checked it out, and I did have a blockage of 80% in one of my arteries, and I had to intervene on, and I had to cancel my trip to Uganda, obviously. So you can imagine if I went to Africa and I was in the middle of nowhere, maybe the outcome would have been completely different. The signs that I preach to look for with my patients, I experienced myself, and I was able to save my own self, from a bad outcome. That lesson taught me a lot more than what I anticipated. I feel now, like before I used to have a lot of sympathy with my patients, I feel now that I can have empathy with them, considering the fact that I have gone through this at such a young age. It was very shocking and surprising to me because I've done everything right. In my case, we used a stent that is specifically to the size of not only the lesion of where the blockage was, but also the vessel. And it basically crushes the area where the blockage is, and then therefore you have the artery open at that time. It was a little bit odd because I'm always on the other end of it, so I'm always looking down at the table. It was for the first time that I was on the table looking up at the machines, it was an unfamiliar view from the other perspective, but it felt comfortable because I knew the skill of the physicians that are here. So I work with them intimately, so I knew what they're capable of doing. It was an easy choice for me to make. So being on the other end, it was a great care, very knowledgeable physicians, that we deal here. Our cardiology department is very strong. And whether it's from the diagnostic part to the invasive part to the interventional part, every aspect of this department is top-notch. A simple screening might have maybe changed this outcome, maybe changed the fact that I was having chest pain. If I would have maybe screened myself earlier, but I had no signs, no symptoms either. So it's very important for people to get tested and to just be preventative, whether a simple ultrasound, which was called a vascular screen, or whether you do a calcium score. The return on investment is very high considering the fact that they're not very expensive. I would totally recommend that because that can save your life.